Hello, first year faculty team. This is our first video of the semester. This video contains some important clinic information and updates for you. You can also find this information on the digital newsletter, so you've got a couple ways of getting information from me. Whatever your preference is, you can read it, you can watch a video, or you can do both. So we are in week 5, which means students are going to begin seeing real patients. They will be seeing patients Monday, Tuesday, and Wednesday of this week. On Thursday, they will not have patients. They'll be doing the impressions lab, and we only need RDH instructors on Thursday. We do not need our dentist team for the Thursday morning and Thursday afternoon clinics. For the Monday and Wednesday evening clinics, there will be a second year student peer teacher in those. So the peer teacher can assist the first year students. They, if you recall, can also complete polish and OHI checks. So you can delegate that. And, they can answer questions, give advice, help the student take radiographs, things like that. Their job, though, is not to clean the rad rooms and things like that for the student. They're there to help teach and instruct. One important note for this week is that students who have not completed the digital radiology skill evaluation, and I've got about 4 of those students, cannot take radiographs unless they are watched. So please, before a student goes off to take their x-rays, ask them if they completed that skill eval. If they say no, if there's time for you to watch them take radiographs, that is fine. But most likely there won't be. And so they'll need to delay taking those x-rays until the second appointment so they can get the skill evaluation completed. And they complete that with me. If you do find yourself with enough time to watch, you are going to watch them take bite wings. If they are doing the FMX, you need to watch the first 10. And in that case, if you are able to watch that first 10, I'm going to ask you to have the student open up that digital radiology skill evaluation, and I'll have you fill that out for me, please. Lots of guidance is going to be needed this week. The students are really nervous about seeing their first year patients, their first real patients. They did a really good job during our dress rehearsal on Tuesday and Thursday. Tuesday, they practiced the paperwork side. Thursday, they got to practice patient care. However, in years past, they had a second clinic session scheduled with their student partners where they would start scaling and complete the rest of the paperwork and, get through the end of an appointment. And because of snow days, we didn't do that this year. So for lots of these students, this is going to be their first time scaling a patient, their first time having a scale check, completing their clinical findings form, doing OHI, polish, the whole thing. So please just give them a lot of guidance, be open-minded. They're not going to know everything. It's their very first time doing this. When you're filling out their patient trackers, unless it's really severe, we're not going to give out critical errors this week. We'll give them a week to kind of get into the flow of clinic. But if something's really serious and you feel like, hey, this needs more than a warning, you can give the error, reach out to me if you're not quite sure what to do. Otherwise, let the student know what happened and that it would be a critical starting next week. For their patient trackers, I also tend to be a bit lenient this first week. If the student misses something like an area of recession, perhaps, or maybe they forgot to put the etiology on a problem on their care plan or something like that, I will kind of talk them through it. I'll give them the S and let them know, hey, next time this would be an NI or a U. Again, first time doing scale checks, so remind them the order is upper right, upper left, lower right. They need to get a scale check after each quad. However, if they're waiting for you, they can move on to the next quad and you can check both quads at that time. We have one left-handed clinician. That person can start with upper left and kind of do the sequence in reverse. Totally fine. You may need to show the students, if you feel calculus during check-in, that would be a great time to let the students kind of feel that with you. Show them with the Explorer what you're feeling, have them feel it so they can kind of learn to build that skill. And it's also a good week to give them tips for what kind of instruments to use, as well as to setting time goals for how long it should take them for each one of those quads. But again, please just be mindful they didn't get to go through the dress rehearsal piece on scaling, polishing, and self-care instruction. So they're going to need a little bit more help with that this week. Another thing I wanted to touch on is skill evaluations. I do think you're going to definitely have students wanting to complete skill evals this week. A skill eval is the student telling you, I feel I am competent in this skill. So they can't ask questions. They can't ask you if they're doing it right or try to get hints. Either they know how to do it and they can demonstrate it, or they don't. So please take your time with the forms. Read the top of it so you know which area or teeth you're going to assign. Make sure you fill out your part of the skill evaluation, which is going to be the area section. At the top of the form, you can fill out the try number for the student, or they can fill it out. Either way is okay. You're going to fill out the 2s, 1s, and 0s. And then sign it, of course, and let me know if it's an S or a U on the form. You can write comments if needed. Again, don't answer questions about what they're doing. They need to show you that they are competent with whatever it is. If they do happen to fail a skill eval, please leave a note in my mailbox so that I am aware. Every once in a while, the student will not upload the form for a failed skill eval. So that's like our cross-check system. So let me know if that does happen. The panoramic is a tutorial. So any student who's taking a pan for the first time, if they ask you about that, you're walking them through the steps of taking a pan. The instructions are posted on the wall. I just read them off to the students and make sure they follow them correctly, and then fill out the form, and then they will be able to get that uploaded for me. So the last piece of advice I have for you with your trackers and with your skill evals is to just make sure you stay consistent. Always do your skill evals the same way, do your patient trackers the same way, so that there's no hints of favoritism or inequity or anything like that. So please just make sure that you're fair and consistent in all of your grading processes. That's all I have for you for our week 5 here. If you have any questions, concerns, don't hesitate to reach out to me. Of course, I'm always happy to help. Hope you have a good week.